Hey everybody, I recorded this video. This is just a little intro to the actual video. I initially recorded the video and it was 50 minutes long, so I decided to split it into two different videos so that it'd be easier to watch, especially if you don't have an hour to sit down and watch one video. Hi, did you miss me? If you well, I guess you should be able to tell from the title why you missed me. So, yep. I don't even know where to start. I think I'm over it enough now to talk about it, so I'll let it out there. Initially, I had told I didn't want to tell anybody about the pregnancy until I got to week 12, when the chances of miscarriage fall significantly. Now, I have two kids, 9 and 11 years old, and I didn't have any complications with those kids. So I wasn't anticipating a miscarriage, but at the same time I wasn't counting it out. So it's one of those things that you don't really think about. Well, I know there is the chances, but there was at no point in time, even though I said I'm not telling anybody until I get to 12 weeks, there was no point when I really thought that I wasn't going to get to 12 weeks. So I was preparing to get to 12 weeks to tell everybody. I told 3 of my friends. I didn't tell any of my family members. So went to my 6-week appointment. Well, I had called the doctor's office and they had said, I didn't realize at the time that I had called the wrong branch. So the lady that I spoke to said, I don't need an appointment, I just need to come in, and depending on the time that I came in, there would be a different doctor. Anyhow, I went when I knew that I was gonna be around 6 weeks. I went to the doctor. I had done pregnancy tests before. Knew that I was pregnant. Had an idea. Well, using my my last menstrual period, I estimated 6 weeks, and I went to see the doctor at that time. So I went in. The doctor, as I said, I had called the wrong branch. So initially when I got there, they said, oh, I need an appointment. So I said, is her day full? She wasn't there yet, and they said I could wait. I think they called her and she said she would see me. So I waited, and when she got in, she actually saw me first before, because I think her first appointment didn't show up. So she actually saw me first. Her second appointment was there. So she did her physical examination, then we did the ultrasound, and look, she said the baby was in the right place, and my ovaries were clear, everything looked good. And we were able to pick up the heart flicker, and she said that that was a good sign. Typically when you can pick up the heart, so I couldn't hear a beat or anything, but I could see the thing on the screen of the ultrasound machine. So she said, she pointed out to me and she said that's the heartbeat. But of course there was nothing for us to hear. To note, we used the intravaginal wand. I don't know if that's the official name for it, but yeah, that's what we used for that ultrasound. So everything looked good. I was told to come back in a month. Went back in a month. The day of my appointment, I was 10 weeks and 2 days. Oh, the first appointment, she said we would just use the last menstrual period to estimate where I was in the pregnancy. However, she didn't give me a due date because she said it was too tiny, so the machine wasn't giving an estimated due date based on the size. Fine. So we went in at 10 weeks and 2 days. Daddy was not at the first appointment. Well, he came with me, but because we had to wait and he had to go to work, he couldn't wait until she got there. So he didn't get to see all of that. Just the picture is all that he saw, which was not much to see at 6 weeks, you can imagine. 10 weeks and 2 days, we go into our appointment. Both of us are there. Doc does her physical examinations. Everything looks good. She tried the wand, the regular ultrasound wand on the abdomen. She wasn't finding anything, so she said, okay, we're gonna go use the intravaginal wand or probe or whatever it's called. So at this point she said, okay, call him, because he has a unique name. So she told me to call him. So he came inside and I was, of course, on the bed or table or whatever you call it, and they were to my right. So he was standing by my head and she was standing by my lower body, and we were all looking at a screen. Came up, saw the baby, and she was like, there's the head, 2 arms, 2 legs. I could see my baby perfectly formed where they were supposed to be. Developmentally, that's where they were supposed to be at 10 weeks. And then what seemed to be eons passed and weren't hearing a heartbeat. Wasn't seeing nothing on the screen. And I remember thinking to myself, didn't she find it faster the first time? Until he broke the silence. He said to her, does it usually take this long? And she said, I am concerned it shouldn't be taking this long. So at this point he puts his hand on my arm and she tries again. At this point, I guess we were supposed to be able to hear the heartbeat, so she was doing something that she didn't do in the first ultrasound. So she was like, it seems to me like she was selecting the area where the heart was, and then she kind of pressed something that would play the sound, and there was no sound. So she stopped that and she did some other things, and then she showed us. She said, this is the baby's heart, it's not beating. And then she showed us, this is the, I don't want to tell any lies, I think she showed us the uterus, and she was saying that there was the lining or whatever the baby was in. I don't remember exactly what it is. And she said, but she did say that there's supposed to be blood flow here, and what she's seeing is indicating no blood flow. And then she did it for the baby as well. She said there's also no blood flow in the baby. At this point I haven't said anything. So he says, is it possible that it could have been the machine? And she said, she's gonna have me come back. Well, she's gonna have me go up to the hospital the next morning to do an ultrasound on a more advanced machine to check But she did go ahead and tell me that this sometimes happens. It doesn't happen for any reason. It just happens. And then she also said that in the babies, I think she gave us a percentage, like 70 something percent of the babies that just their hearts just stopped beating when they were tested. It was found that something didn't develop properly, and so the body just kind of took care of it. So she said she was gonna give us some, some time. She reassured us that it's something that happens and nobody knows why and whatever. So she did all of that, and then she said, I'm gonna give you guys some time, and once you're ready, you can put your clothes back on and you can come back into the office. So of course I was just lying there the whole time, blank and emotionless. I mean, I'm pretty sure that happened in probably like a minute or 2 minutes, and it just felt like forever for me. So she came out and I sat up on the bed. I stood up and then I started to cry, and he hugged me and he said, don't cry, it's not your fault, and he didn't want me to cry because he didn't want to cry. I did actually see where his eyes welled up a little bit, so I wiped my tears and did a little check to see if there was gonna be any more coming, and then I said, I put my clothes on. I said, I'm good, we can go out now. And then we went out into the office, and she told me, come by the hospital in the morning, we're gonna do another ultrasound to see if we missed anything. The next morning I went up to the hospital. She met me there, we did the ultrasound, and that ultrasound actually showed us something that we didn't see on the other ultrasound. So she showed me there was this little dark spot around the baby. I guess it was in the lining of my uterus. There was a little dark spot there, and she pointed to it and she said, you see this dark spot here, it indicates bleeding. So there was I don't know, there was some amount of bleeding around the baby, so it was confirmed. And based on the development of the baby, it's something that had happened within the past 3 days. So it was like it just happened. The baby was fine up to that weekend, because we went in on a Monday, so the baby was fine up to the weekend. So she gave me the options she said, well, we could medically manage it, and if that worked, if that didn't work, then we would have to go in and do a DNC. So she prescribed the medication. I do believe it's, if I remember correctly, it's misoprostol or something like that. Something like that. So she gave me the prescription, told me to go fill it, go home, told me what to do. I didn't go and fill it right away. I started to work. I of course called my boyfriend and I told him, it's real, it's a thing, the baby is gone. So I went to work that morning. I didn't just go get the medication and go home. I went to work, and then one of my pharmacist friends, I felt weird going to the pharmacy with that prescription. So I had asked one of my pharmacist friends, I had sent her a picture of it, and I said, do you have these things in stock? And she said she didn't have the first one, and the first one was because there was, along with that, there was antibiotics and painkillers. The first one was the misoprostol or misoprost whatever, that the hormone tablet that would induce labor in a sense. So she said she didn't have it, and she told me where I should go and get it. She's like, they have it apparently. And that particular pharmacy that she mentioned is a pharmacy that I have had previous experience in knowing that when you can't find something elsewhere, they typically have it. Even if they just have one, they typically have things that other pharmacies don't carry. Anyhow, I went, and it's kind of weird because I'm a med rep, so I'm going into the people know me, so it was kind of weird. And the guy was like, he was kind of whispering, and this is one of the reasons I didn't tell anybody, because I said, you know, if anything happens, people tiptoeing around me and feeling sorry for me and all that would just probably depress me more. So I'd rather not tell anybody if anything happens. I deal with the loss, deal with the grief in my own little way. And I know it sounds selfish. It is selfish. I have been told that I don't know how to allow people to be a friend to me, and it's true. But for me, it's just easier to get over something by myself than to have other people involved and trying to comfort me. And I don't know, it's pride, but yeah, that's one of the reasons. Anyhow, so I went into the pharmacy, gave the prescription, and he was kind of like, did the doctor tell you what to do? And I said, how do you mean in terms of how to take the tablets? Because I was supposed to insert some, and then I was supposed to take some orally, but I didn't, at the time I didn't realize that whatever I was inserting was the same thing that I would be taking orally. It's at that point that I realized that was the case. I'm sorry. So I said, I repeated what she said to me, and he said okay, and then he asked if I was gonna go home now, and I said yes, which I didn't go home now. But I could see the concern, and I guess there was a little bit of discomfort in dispensing the drugs to me, if that makes sense. Because once you see that, you have an idea of what's going on. So as I said, I went on and I worked for the rest of the day, and then I went home and I was doing some reading, and then in the night now I think I said okay, I'm ready to do it. The doctor did tell me that I was gonna be in a lot of pain, and it's gonna pass a lot of blood and clots, and the baby would come out in one of the clots. So you know, I got ready for it. I did some reading, and it said that it would start work within 15 to 30 minutes. So I was like, okay, kind of get myself in the mind frame that this is kind of, because up to that point it never really sink in, say the baby really gone. If you remember in my first video, I was talking about my boobs. Oh my god, my boobs are so, yeah, so that's why my boobs were so, and up to that point, even